Hello, everyone. We're giving folks just a second or two to join, and we will get started shortly. All right, I keep seeing the attendance numbers go up, so that's good. I think we can get started, Jacob. I hope everyone's having a great Thursday. Hello, and thank you so much for joining us today to take a closer look at the connection between outdoor air pollution and health. I'm Alana Clark-Kirk, the Education and Communications Manager at HPIO. And my friend Jacob here is going to move my slides for me. Thank you, Jacob. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending. I want to make sure I thank our core funders who support HPIO's mission with their generous investment in our work. I also want to thank our 2023 educational event series sponsors who make our forums and webinars possible. A special thank you to the SC Ministry Foundation for their support of our brief, A Closer Look at Outdoor Air Pollution and Health. Throughout our 30 minutes together, I want to encourage you to tweet, post on LinkedIn, and share the content with your colleagues. And during the webinar, we also encourage you to put questions in the chat or in the Q&A box. Our colleagues will be monitoring both and will share resources with you in the chat. All the information shared today can be found on the HPIO website under the category Events.
Give it 1 second.
All right. I'd like to introduce the author of our brief on the effects of outdoor air pollution and health. Jacob Santiago is a policy and evaluation specialist at HPIO. He will walk us through the key findings from the brief. Hi, Jacob.
Hello, Alana. I just want to thank you and thank everyone for being with us today. And I'm happy to be with you all this afternoon. Before we kick off the rest of the webinar, we wanted to acknowledge the train derailment and toxic chemical release that happened in East Palestine, Ohio. This brief that we're discussing today was published before the train derailment, but we know that this event has and will continue to have an impact on air and water quality in Ohio and affect the health and well-being of Ohioans and others around the Ohio Valley region. We plan to continue our work on the natural environment, and we'll be continuing to include updated data and information on air and water quality in future work. We have included a list of resources on our website if you want to learn more about the impact of the derailment on the environment. Level set us all, I will start here with this pie graph that describes the modifiable factors that influence our health. When we think about improving our health, a lot of us think about our health behaviors, how we eat, move, and treat our bodies. We see here that those behaviors represent 30% of the pie. Many will also think about our interactions with the healthcare system, which make up 20% of the impact on our health. However, in dark blue, you see that 50% of the factors are in our social, economic, and physical environments. These are the conditions of our communities: housing, transportation, education, employment opportunities, as well as the air we breathe and the water we drink. In order to improve health, we need to pay attention to all of these factors, including the communities in which we live and the policies, systems, and structures that give people a fair chance at a healthy life. When analyzing data included in HPIO's 2021 Health Value Dashboard, we found that the conditions of the physical environment, clean air, safe places to walk outside, and access to healthy food are strongly correlated with the health of a state, surpassing the effects of healthcare quality and being able to access care. And in the 2021 dashboard, Ohio ranked 47th out of all states and DC on health value, which is the composite score of population health and healthcare spending. Those rankings are at the bottom of this slide, and the conditions of the physical environment are strongly correlated with population health. And when specifically looking at how Ohio performs on air quality compared to the rest of the country, we again are at the bottom of the pack, 46 out of 51. But it's important to know that improvement is possible. There are a set of pollutants that the Environmental Protection Agency are required to track by the Clean Air Act, including nitrous, sulfur, and carbon oxides, smog, lead, and particulate matter. This last piece, particulate matter, is a mixture of dust, dirt, smoke, and other chemicals, including those listed above. Fine particulate matter, which is 2.5 micrometers or smaller, accounts for most of the health effects of air pollution because it can be inhaled more deeply into the lungs because of its size. Now, where are these pollutants coming from? There are 4 main sources of pollution listed on the screen now. They include mobile sources like cars, buses, planes, and trucks, stationary sources like industrial sites and power plants, area sources like agriculture and cities, and natural sources including wildfires and dust. Over half of air pollutants are emitted from mobile sources, and mobile sources and stationary sources are the primary emitters of fine particulate matter pollution. These are our 3 key findings from the brief, and we're going to look at each of them in more detail throughout the rest of the webinar. Our first key finding is that improving air quality will lead to improved outcomes. So you may be asking yourself, how does air pollution affect our health? On the screen now is a list of some of the outcomes that are affected by air pollution exposure. This list includes things that correlate with air pollution, like dementia, COVID-19, and various cancers, and things that are caused by pollution exposure, such as asthma, COPD, and poor maternal and infant health. And the longer someone is exposed to pollution, the more impact there will be on their health. Over the past decade, air quality in Ohio and around the United States has greatly improved, but there's still room for both Ohio and the nation to further reduce exposure to fine particulate matter and other types of pollution. We saw earlier Ohio's performance on air quality, but when we look at measures related to pollution, we also perform worse than most states on those measures. For example, most Ohioans drive long commutes alone to work, and few use alternative commute modes such as bikes or walking. This means that mobile sources of pollution are used more often by Ohioans than modes of transit that have a limited or non-existent environmental impact. And when we break the data out, we see clear racial and geographic disparities in who is more likely to be exposed to polluted air. I want to quickly take us back for a second to this modifiable factors pie and draw attention to the red box at the bottom, these underlying drivers of inequity. When we think about health and health outcomes, not only should we be thinking about the things that are a part of the pie itself, clinical care, conditions of the environment, and health behaviors, also things that might be driving differences in outcomes, such as racism and other forms of discrimination, and experiences of trauma, toxic stress, and stigma. For these next few slides, I invite you to think about the ways in which these underlying drivers are causing and contributing to differences in outcomes for different groups of Ohioans. Ohioans of color are more likely to be exposed to polluted air, with Black Ohioans being almost 1.5 times more likely to be exposed than white Ohioans. Past and present policies and practices, such as zoning policies and redlining, have caused Black Ohioans and other Ohioans of color to live closer to sources of pollution, like highways and industrial plants. These policies and practices have also limited the presence of and access to green spaces and parks in Black neighborhoods. Trees and other vegetation found in green spaces play a significant role in reducing pollution by absorbing gaseous pollutants and temporarily removing fine particulate matter from the air. Geographically, much of central and western Ohio are exposed to high levels of fine particulate matter pollution. The map on this slide displays the average daily density of fine particulate matter pollution in each Ohio county, with the dark blue counties having the highest daily averages and the light blue having the lowest daily averages. What this shows is that many of our urban areas and agricultural communities are exposed to higher levels of pollution than most suburban counties and even the state overall. Stationary, mobile, and area sources of pollution are the sources likely contributing to these increased levels of pollution. However, air pollution is ambient, which makes it difficult to attribute high levels of pollution to a specific source, especially over a large area like on this slide. Research also shows that children, older adults, people with a pre-existing condition, and people with low incomes are all at an increased risk of exposure to air pollution compared to other groups. Our next key finding from the brief is that Ohio has implemented policies that both advance and harm efforts to reduce pollution and improve air quality. Policymakers in the General Assembly, at state agencies, and in local governments have all made decisions that have helped or hindered efforts to improve Ohio's air quality. Here are some examples that have had a negative impact at the state level. In 2019, the General Assembly passed House Bill 6, which reduced Ohio's renewable energy benchmark for power plants and electric service companies. Before HB 6 passed, power plants were to get 12.7% of their power from renewable energy by 2027. HB 6 reduced that to 8.6% by 2026. The bill also reduced energy efficiency standards in the state and subsidized 2 coal-fired power plants. And in 2021, the General Assembly passed Senate Bill 52, which allows local governments to block the development of renewable energy plants in their area. However, local governments do not have the same veto power for energy plants that use fossil fuels. Now, here are some examples that have had a positive impact at the state level. The Ohio Department of Transportation received $100 million in federal funding from the Federal Highway Administration to develop electric vehicle infrastructure over the next 5 years. including charging stations and other provisions of Ohio's electric vehicle infrastructure deployment plan. And the Ohio Environmental Protection Agency will receive $75 million over a 10-year period from the federal EPA's Volkswagen settlement. These funds are awarded as grants from the Ohio EPA to projects that reduce nitrogen oxides emissions. And projects from the latest round of grants are estimated to remove 33 tons of nitrogen oxides and 16 tons of other air pollutants annually. Local governments have done much to reduce the impact of mobile sources of air pollution. For example, the Stark County Regional Transportation Authority added 10 hydrogen fuel cell powered buses to its fleet, making it the largest hydrogen powered fleet outside of California. They also opened a hydrogen fuel facility in 2018. And the Mid-Ohio Regional Planning Commission has helped over 100 local governments, schools, and businesses to develop idle-free policies, which encourage people to turn off their vehicles when they are parked. Our last key finding from the brief is that policymakers have opportunities to improve air quality through policy change. There are several things that Ohio policymakers at all levels can do to continue the improvement in air quality that we have seen over the past decade. I will list a few of the options along with examples of implementation, but there are more policy options listed in the brief. So at the state level, the state legislature can adjust the alternative energy portfolio to its original schedule and set long-term targets for renewable energy usage in the state. For example, Maine has a state statute that requires 40% of its energy load to be satisfied by renewable energy by 2030. At the local level, local governments can increase the presence of and access to green spaces and parks, so every member of their community can reap the benefits of being close to nature. The city of Westerville here in Central Ohio is a great example of this. They set a desired outcome in their 2016 community plan for each resident to be within a half mile of a public trail or park. And by 2018, 89% of households had met this target. Local governments can also include complete streets concepts in the development and rehabilitation of roadways and other transportation infrastructure projects. These concepts enable pedestrians, bicyclists, public transit, and motorists to share and use streets and accommodates the needs of all travelers. In November of 2022, Cincinnati passed an ordinance adopting complete streets concepts for all project phases of new and existing roadways within the city. There are many ways that you all here today can be involved in influencing public policy and helping see these policy options come to light at the state and local levels, both as a private citizen and as a representative of your organization. On the slide now are some examples of how to have your voice heard and to offer your expertise to help policymakers make informed decisions. And we know that this work does not happen in a vacuum, and that it is by working together that we make Ohio a model of health, well-being, and economic vitality. I know that we here at HPIO could not have done this work without the time, energy, and expertise of the members of our Outdoor Air Quality Advisory Group, which included organizations in the transportation sector, city and regional planning, and public health. I want to thank you all again for joining us, and I believe we have some time for a couple of questions.
If you have questions, feel free to put them in the chat in the Q&A box, and we will, or you can also raise your hand and we'll see if we can get a few questions going. In the meantime, Jacob, I think we can move forward.
All right. Just want to share with everyone my contact information. My email's there, and then, of course, more information is on the HPIO website, including a recording of the webinar that will be made available, and some additional information on East Palestine.
Thank you, Jacob.
I believe we have a couple of poll questions for you all, and
Yep, I'll put those up.
awesome.
If you wouldn't mind voting for us on today's polls, it'll only take a second. We put them together so that it's quicker. Thank you for your feedback in the chat, everyone, as well. And Jacob, this might be a good time to address some of the questions in the chat while people are taking the polls.
Yeah, of course.
All right. I see a question from Kathy. Since trees play such an important part in air quality, what can you say about ordinances to protect mature trees on public and private land? Any thoughts on that, Jacob?
I definitely know and have heard that mature trees really help with the stability of local environments and their roots. There's a lot of botanical science there, but they certainly play a vital role, just as planting new trees does.
Yeah. And Kathy, maybe this is a good opportunity, since you're asking about ordinances, to get involved with the policymaking process. Like Jacob had some ideas on that slide. I see a question from Melissa. Are you aware of anyone in Ohio doing research on the effects of air pollution on reproductive, maternal, or child health?
I am not Melissa, but if somebody else on the call knows, please feel free to pop that into the chat.
Dr. Long has her hand up, and I'm going to let her ask us a question. Hi, Dr. Long. You can unmute and ask your question.
Hi.
Hi.
Hello.
What was your question for Jacob? Well,
I believe you're still muted, Dr. Long.
Hi, I'm so sorry. I didn't have a question for Jacob. I'm still
Oh.
this, so my apologies. Wasn't even touching my screen. So
Okay, that's fine. Thank you.
No worries.
Good to see you.
yes.
All right, I see a question from Rebecca. Air quality is one of the measures in our CHA. We have several factories that are in our county. We're now looking for data regarding effects of that in our lung cancer statistics. So that was just a note from Rebecca. So
Yeah.
we're seeing some things.
And it's great to hear, the local efforts that are happening to assess the impact of air quality on health.
All right. I'm not seeing any other questions in the chat. I will put a link to the brief in here as well. Jacob, if you have any final thoughts for us, we can hear those now.
I don't. I'm just, if you all have any additional questions, I can scroll back up to my contact information, and please feel free to reach out if you have additional thoughts or questions on the information that was shared today, or anything else that you all think HPIO should take a look at regarding the physical environment. I see another question in the chat. How are other communities measuring the effectiveness of complete street policies on air quality? That is a great question. We use a source called What Works for Health. And they have a whole list of strategies that they have assessed. It's a database of, I can't think of the word, but they collate all of the research and information on specific strategies, including complete streets. And that is one place that we have turned to kind of get an idea of what works. And they have rated complete streets. I think they say there's some evidence of effectiveness. Thank you, Amy, for throwing that into the chat. All right. And thank you, Carrie, for putting the link into the chat. All right.
Thank you, everyone, for being here today. If you have further questions, please email Jacob. We look forward to seeing you at our next online event or in-person event coming soon. All right. Bye, everyone.
Y'all.